If you're anything like me, like learning anatomy through sports injuries, this is episode 58. McKenzie Milton, November 23rd, 2018. The Wheel has spoken. Let's take a look at it. So McKenzie is the quarterback for UCF here. He's going to roll out to the right and take a hit directly to his knee from a defender. And there's not another angle of it for obvious reason, and it's because of this. All right, so that leg is obviously not looking the way it's supposed to, but I did slow it down just to take a look at it. So in this frame, he's going to plant his foot, and the defender's already making contact with his knee. And his foot actually inverts, and then he rolls over it. His momentum carries him forward, and that's not good if you're McKenzie Milton. So what is involved here? Well, it's a knee dislocation. So what do you think it is? We're going to talk about this in a second. But what did happen, what the danger here is torn popliteal artery, or popliteal as some people like it to be called, and tibial nerve damage. All right, so obviously behind your knee, you have this popliteal artery and the tibial nerve going right behind your knee. This is your hamstrings, and this is your calf here. So just a posterior view of the knee. And this knee is not looking good. It's dislocated here. You can kind of see a deformity there. His foot is excessively internally rotated. It's not really supposed to go that far, but that's obviously not good. So what did they do? A long one, but I think it's a great story here. So team physician for UCF actually did an on-field reduction, basically putting it back into place. The dorsal pedis pulse was absent. Okay, so on the field, it was absent, which means there was no blood flow getting to the foot. And this is where the dorsal pedis pulse is taken here on the top of your foot, kind of close to your big toe. So they stretched him off, took him to the locker room, did another pulse check, and again, it was absent. So they had to take him to the hospital and do emergency surgery for the artery damage here. So they first did bone realignment, and then they took his saphenous vein from his left leg and transplanted it into his right to create a new popliteal artery. So once they did that, they had to address the nerve damage, which it was kind of best case scenario, I guess, because it was stretched and not torn. If it was torn, there'd be no motor function at all. But since it was stretched, it can regenerate slowly over time, and it regenerates at about 1 millimeter per day. So they waited 2 months for a knee reconstruction, and it turned out the only ligaments that were torn was the LCL and the PCL. Really a shocker here. The ACL was intact, so was the MCL. So those two are obviously very important for anterior translation of the tibia, as well as varus or valgus control, but varus control and posterior translation, kind of rarer, most commonly seen in like car crashes, and that's what some of the doctors said as well. So McKenzie actually did return to sport September 2021 after he transferred from UCF to Florida State, and then he retired in 2022, unfortunately due to his medical injury, and now he's a coach. That is McKenzie Milton.